Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor who sees my share of disc herniations and have over the years, generally do well with them. This particular study really kind of rings home, and it talks about how to best merge or use together different aspects of medicine to get people better. And this has to do with sciatica from a disc bulge. Now keep in mind, if patients come in, they're like, oh, my sciatica's hurting, or they'll point to their sacroiliac joint. True sciatica involves a specific pattern that extends into the buttocks and into the legs along the pattern of the nerve. So just because you have leg pain does not mean you're having sciatica. And if you have just local back pain, so it's not going anywhere, it's right there in the back, that doesn't qualify as sciatica. Doesn't mean that the sciatic nerve isn't irritated, but it is not sciatica. So before we go further, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. So in this study, it was done out of the Netherlands, 72 people that were on the waiting list for lumbar disc herniation surgery. So these people, it was all confirmed they had this, and so they were either put in a control group, which was just waiting, which was what they normally do, or they were given a pattern. So it was 38 that were given in the control with no treatment. 34 of the people were given McKenzie's exercises. It has to do with extension and finding a directional preference, and it was combined with transforaminal epidural steroid injections. And so basically kind of using the best of both worlds, not just the conservative treatment, but also pharmacological treatment at the site of inflammation. So the real take-home message is that we shouldn't do anything just because we shouldn't do nothing, because just because you have a disc bulge does not mean it can't resolve on its own, or with conservative care it absolutely can. And I would typically say most often it does, whether we're talking about neck or low back. If you treat those correctly, they frequently or more often do not need surgery. I'd be lying if I said I fixed everybody. We certainly have patients that have gone on to have disc surgery, but when treated conservatively, the effectiveness is definitely worth a try. Our office uses a technique called flexion distraction, which versus extension. We found that ends up being very effective for disc problems. Not discussing techniques here, but the bottom line is they went through some type of disc-oriented conservative care combined with the epidurals. So what were the end treatments? So who ended up still having surgery and who didn't? In the control group, 76% of them still had surgery. So that's a pretty big chunk. Now, keep in mind that means 24% of them ended up resolving spontaneously and not having surgery. In the treatment group, 32%. That's an 85% reduction in the people that needed surgery when they didn't just sit on the sidelines. They had active treatment done to help with their condition. So take-home message is, even if you have a disc bulge creating sciatica and you've been told you're a surgical candidate, doesn't mean you can't set up that surgical date, but you absolutely should continue with conservative care. I always say that the epidural generally doesn't, by itself as its own tool, rarely works in the long run, but it really calms things down to make things way more comfortable while the conservative care is happening. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs information, and subscribe to the channel.